It's hard to predict who's likely to commit suicide, even for close friends and family. When Dorothy Paw's son Peter took his life, her family was devastated.
We had no idea, none of us. There were really no signs. He never said a word to anybody.
Suicide is a health issue that is rarely covered, shrouded in stigma and secrecy. Doctors Thomas McCoy Jr. and Roy Perlis decided to see if they could find anything that might indicate that a patient was suicidal. They started examining hospital discharge notes for close to 500,000 patients.
The primary objective of this study was to try to build a model to understand a little bit more about risk factors for suicide. And so in particular, what we wanted to understand was, could we get additional information out of what doctors write in the chart when patients leave the hospital?
They examined discharge notes and used a computer that was sensitive to the language used and descriptions of the patients.
We were encouraged to find that the natural language processing, having the computer try and quantitate what the doctor wrote at the time of discharge, could improve our ability to predict this difficult outcome.
McCoy, Perlis, and other researchers at Massachusetts General Hospital found that certain words, such as unfortunate or poorly, could predict a higher risk for suicide.
It's a tool that lets us pull other things out that otherwise we would miss if we just looked at diagnostic codes and medicines and people's age and gender and so forth.
The doctors acknowledge they are just at the beginning of being able to predict suicides. They would like to see if discharge notes from hospitals in the U.S. and other countries could also indicate who's at risk.
And if we can make predictions about who's at high risk, we can better target resources, we can better target interventions to reduce this risk.
The study was published in JAMA Psychiatry, a publication of the Journal of the American Medical Association. Carol Pearson, VOA News, Washington.